Takutsubo Cardiomyopathy, also known as stress-induced cardiomyopathy or broken heart syndrome, is a temporary heart condition that mimics the symptoms of a heart attack. It is characterized by a sudden weakening of the heart muscle, primarily affecting the left ventricle. Takutsubo is a Japanese word meaning a pot with a narrow neck and a round bottom used to catch octopuses. When the left ventricle of the heart changes shape, it develops a narrow neck and a round bottom, making it similar to the octopus trap. The exact cause of Takutsubo cardiomyopathy is not well understood, but it is believed to be linked to a surge of stress hormones. Factors that may increase the risk include extreme emotional stress, such as the death of a loved one, divorce, or financial problems, as well as physical stressors like surgery or serious illness. Takutsubo cardiomyopathy is more common in women, particularly post-menopausal women. After an emotionally or physically stressful event, the body releases stress hormones such as adrenaline, which can cause arrhythmias and temporary apical enlargement of the left ventricle. Signs and symptoms of Takutsubo cardiomyopathy typically begin within minutes or hours following exposure to a stressor. Common symptoms include angina, diaphoresis, nausea, vomiting, and shortness of breath. Patients may also experience palpitations and low blood pressure. The diagnosis of Takutsubo cardiomyopathy is based on clinical presentation and a history of a stressful emotional or physical event. Criteria for diagnosing Takutsubo cardiomyopathy include the presence of transient left ventricular wall motion abnormalities characterized by ballooning of the left ventricular apex. ECG findings are similar to those seen during myocardial infarction, like ST segment elevation or T-wave inversion. However, cardiac enzymes like troponin may show normal levels or modest elevation. Unlike a heart attack, there should be an absence of obstructive coronary disease or angiographic evidence of acute plaque rupture. Additionally, conditions like pheochromocytoma and myocarditis must be excluded to confirm the diagnosis. Treatment for Takutsubo cardiomyopathy is generally supportive and focuses on relieving symptoms and preventing complications. Common approaches include medications to reduce the workload on the heart, such as beta blockers, ACE inhibitors, and diuretics, and managing any underlying physical or emotional stressors. Most patients recover fully within a few weeks to months, with a low risk of recurrence.